Medical doctors in Ogun State, under the aegis of the Nigerian Medical Association (NMA), have embarked on an indefinite strike following unresolved issues on pay disparity between federal and state medical workers. Dr. Azim Kunle Ashimi, the chairman of the Medical Association in the state, who disclosed this on Tuesday in Abeokuta, explained that the decision to proceed in an indefinite strike came after a failed 3-day warning strike. According to Ashimi, the strike, which began on Saturday, 3rd August 2024, is primarily aimed at addressing the pay disparity between federal and state medical workers. Unfortunately, in his words, unfortunately, we weren't able to reach a compromise with the government. The government continues to plead that the issues of minimum wage and other related matters are common, but my people believe that we need to address the issues on ground, Ashimi stated. Well, going on with the story, added that the core of the doctors' grievances lies in the reviewed CONMES, that's the Consolidated Medical Salary Structure, which they believe should be implemented to stem the exodus of medical professionals from Ogun State. Ogun State is losing a lot of doctors daily because of the pay disparity. If the reviewed CONMES is paid, it will encourage the doctors to stay. In efforts to retain medical personnel, the NMA said it has undertaken various initiatives over the past 2 years. And he explained that we have recorded achievements aimed at helping doctors feel a sense of belonging in the community. And I believe this CONMES is one of the steps that we're actually taking to make sure that the payment structure is aligned. And we believe strongly that if the government can promise to pay this money in due time through the memorandum of understanding, we can go back to work. Verbal promises have often led to doubt, hence the need for something penned down. Is it really about something being penned down, or is there really more to it? Because when we talk about the CONMES, this is not the first time we're having stories about doctors wanting to go on strike or going on strike due to the review of the CONMES or implementation of the CONMES. The other day we heard the same thing in Lagos State. Dr. John.
It's a national calamity, actually, because the brain drain thing started way back in the 80s. when qualified medical doctors, some of whose education was subsidized with Nigerian money, started migrating to Saudi Arabia, the UK, America, even some Asian countries like Malaysia and so on. Now, nationally, Nigeria has not been able to address the problem of brain drain. This brain drain has also affected university lecturers. Some of them, they migrate to other smaller countries like Botswana, South Africa. I used to have so many friends in South Africa. Some in the University of KwaZulu-Natal and University of Pretoria. So the brain drain thing, I expect the federal government to come up with a holistic strategy to be able to check brain drain first in the medical profession because Nigeria has a shortfall of medical doctors and other paramedics. If you go to the hospital, you see one doctor attending to so many thousands of people. And you see that brings in ineffectiveness. And that is why our healthcare system, our healthcare delivery system is described as one of the worst in the world. The doctors-patients ratio is not found anywhere in the world. So, Ondo State, is it not? Is it Osun State?
Ogun State.
Ogun State. It's not an isolated case at all. We should come up with, because the doctors deserve to have a unified salary structure, like the university lecturers. NMA, the Nigerian Medical Association, should be able to have a unified salary structure affecting all doctors. There may be state peculiarities, Bayelsa State, Ondo State as well. That is in terms of some allowances. But the pay structure should be the same. It should be unified all over the country. Again, I don't know, because we have lost a lot of medical doctors to so many other countries. So many people, as we speak now, so many people are, those who read accounting and so on, they are going back to the university, going back to some academies to learn nursing. They are training to be nurses. They are training to be caregivers. Because these are the businesses, these are the professions that pay very well out there in America, in Britain, and other countries. So anything a medical doctor says, I feel so concerned, because if you go to some hospitals and you see the doctors, in most cases, where a pediatrician, a consultant should be handling an issue, they bring a house officer to handle it. And before you know, everything has gone wrong. So,
and these are lives that they actually
no, in Nigeria, the lives of people, it's like numbers. They count 1, 2, 3. They don't attach names to them. So if we have to, run an efficient and effective healthcare system, we need to address the manpower production, especially in the area of producing qualified doctors, nurses, and other paramedics.
Okay, so Dr. John talked about our doctors going to other countries and, studying to be nurses, because that's what pays there. Let's get your thoughts on this story.
Well, it's no longer news. Was it 3 years ago, the government even tried to stop our doctors from leaving the shores of Nigeria, because I think one of the countries, the UK, gave them visas, free visas for them to leave. If you're a doctor and you want to relocate, and most of them are just leaving the country. You see, I don't know what is wrong with our government here. Probably because are we actually voting them into power, or they are hijacking power, or they are buying their way into power? Because we always have the wrong people on seats. What is so difficult in ensuring that doctors, that you have enough doctors, and these doctors are paid adequately? Because these doctors are doing a job, they save lives. These are doctors, nurses, and lecturers. These three professions are professions that the government of any country should not toil with. After then, we look at the security architecture and everything. Look, sincerely speaking, if these people are taking good care of it, means that, one, the economy will be productive, because the lecturers are there to produce people that will come and also contribute their own quota to the economy. The doctors are there to save lives. The doctors are nurses. So their pay structure is not something that any government should toil with. The government of Ogun State, up till now, as far as I'm concerned, does not even care. Probably the start of this indefinite strike is going to maybe force them to begin to do something, because I have 1 or 2 friends that are medical doctors in Ogun State, and they were like, the government does not really care if we go on a 3-day warning strike, but we want to believe that this indefinite strike, when patients will begin to cry out, probably they are going to come to say, okay, let us do this. They even want the government to say, okay, look, we will pay. Let us have a memorandum of understanding. Let us have these things penned down, that just go back to work. For the sake of the masses, we will pay. These people are willing to work. The enemy there has done their own bits, bringing them, setting up cooperatives, getting them to buy lands, just to make sure that they pin them down there in the state so that they will not leave. Because if you have a property in the particular area, you will not want to leave your property, and you need to walk away. But all these things are not working again.
Now, sometimes when we have issues of these associations going on strike or calling for something, like the ASU, like the medical doctors, we had the 2009 agreement with ASU and the government. Now we had the CONMES, and now we heard the other day that doctors from Lagos State wanted to go on strike because of the implementation of CONMES, which is actually the salary structure. And now we're hearing the same thing from Ogun State. So what is our problem with implementation? We see a problem on ground.
I'll tell you
we
something.
Call for dialogue, and then a solution is provided, but we don't implement it.
Amy, this is the problem we have. In the Buhari administration, this problem persisted. They went into an MOU that these things will be paid. They were not implemented until after the Buhari administration. Now, government is continuity. When a new government comes in, all they need to do is, these are memorandums, okay, let us look at them. If you feel that these things, based on the economic realities, that you will not be able, you call them, say, look, we understand that there was an agreement like this, but why not we tilt it a little bit? Let's work on it, let's look at it from a different perspective, and based on what we have on ground today, this is what we can actually do.
Okay.
But not doing that and ignoring it totally, allowing them to begin to go on various strikes, you don't have time, you now come up with your own MOU again. The other one is not implemented, you bring your own, another government will come and bring its own. It's something else.
All right, let's hear you, Dr. John.
You see, we have a very beautiful national policy on health. And although there are state variations, all the states are supposed to key into that national health policy. But in Nigeria today, even at the national level, our health care policy is in disarray. Why? Because in most cases, when monies are budgeted for, what has been budgeted for is not disbursed. In cases where such monies are disbursed, you see part of the money being siphoned into areas that are not necessary. Yeah. You see, if not talking about policy alone, we have a fine policy, a beautiful healthcare delivery policy. But again, coming to the states, like I said, the states have their variations, but the states are not working towards keying into the national health policy. Look at the area of sustainable development goals. It's a universal program, but you see Nigeria always taking the back seat in implementing the SDGs. Why? One of the problems is corruption. The second one is executive high-handedness. The third one is lack of political will. When an agreement has been reached and signed between the federal government and a body like NMA and so on, the political will to implement such agreements does not exist. In most cases, the federal government will see such agreements as mere policy pronouncements, unknown to them that an agreement spells out obligations. Do this, it is my turn to do that. When it comes to the turn of the federal, that's the lingering problem between the federal government and ASU. The federal government is always defaulting. And how does a government build her integrity? If we say, like this morning, you called me and said I should come, we have a program by 8 o'clock. If you saw me by 8:30, consistently, anytime you fix a program for 8 o'clock, I come by 8:30. I'm losing my integrity. Yes. So the federal government does not have the moral ligament to even go into such agreements. They will still go into such because it is a federal government.
All right.
Yes.
Dr. John, let's take some time off now. We'll go on a short break. When we return, we have other stories on our table lined up for you. Please stay with us.